Hi guys, welcome to another class. This is a nice slow flow class to really help if we have deeper SI pain. When you're ready, try to find a nice comfy cozy environment for yourself. Lay down on your back, bring your pillow anywhere that feels comfortable. I'm putting it underneath my head. And then we are very intentional with our feet positioning. We're going to wiggle our hips side to side to find some neutrality and some softening of tension. And then we bring our feet out wide, very wide, and then knock the knees in. This, for most people, will change the positioning of our hips and put an opposite form of pressure on the SI joint. For most people who have SI discomfort and pain, we have an anterior tilt through that joint space, from our low back being a bit too tight and tilting of our hips forward. When we let our knees knock in and our feet go wide, we're putting pressure on this SI joint to have more of a posterior aspect based off of how our femur bone is landing in our hip socket. And then when we find this position, we get heavy. We soften our body into the ground. We find some deep breathing into our low belly. And then you can stay here if you'd like, or I really do encourage you to very gently give some love and kind touches to your belly space, a form of self-massage. And you can imagine your hand is a cat paw and you're just kneading along your belly space with holding space in your head for gentle love and kindness and awareness through this belly region. We can viscerally hold a lot of tension in our belly space if we have a lot of stress or anxiety in our life. They're temporary or permanent. Very gently rubbing that belly space can give the part of our nervous system that holds visceral tension the cue to soften and relax. And as you're working the belly space, if you find an area of increased tenderness, try to hold your hand in that space, and instead of pressing deeper with the fingers, really breathe deeper into your belly. Push the edge from the inside with your breath. And when you find those tender spots, hold for at least 30 seconds to allow the tissue to soften underneath your fingers. Good, and then let it all go. Big inhale. Big exhale. Take the pillow, put it between the knees, and have the feet be roughly hip distance apart. Bring your hands down by your side and kind of wiggle your heels closer to your booty. Squeeze the pillow together with your inner thighs and then lift your hips up. And then lower yourself down. Inhale, lift yourself up. Exhale, lower down. Inhale, tuck the tail under, lift the hips up. Exhale, lower. Inhale, lift. Exhale, lower. Next time you have your hips lifted, keep them lifted, but then grab the pillow between your thighs and put it underneath your booty. Lower your hips down. Then take your feet, lift them up into the air as if you're walking on the sky or the ceiling. And then we're going to do a half happy baby. Bend your right knee and catch the shin or the sole of your foot with your right hand. The left leg is active. You're kicking the heel of your foot up, driving your femur bone down into your hips. Finding deep breath into your belly. Good, and then switch sides. Make sure where you're grabbing on your bended leg is still allowing you to find neutral or neutrality in your hips. So the stretch is really happening through your hamstrings. Really working on softening the back of our hips, glute region. So you're engaging your core to really encouraging the pancaking down of your hips onto the pillow. Exhale, let it all go. Come to sitting. And then roll your weight onto your right side. And then roll your pillow into fourth. Bring the pillow into the soft spot between your ribs and the upper crest of your hip. And then just lay yourself down on the pillow. If you need to adjust a little bit here and there, please do so. Like I said, we want this to be on the soft spot between the ribs and your hips. Creating a nice release through the strong stabilizing muscles that connect our low back spine to our hips and femur bone. So our mental in space is really focusing on softening through the belly region, specifically the side of our low belly that's touching the pillow. Maybe soften the gaze. Work on finding that heaviness that you found at the beginning of class. That's softening and relaxing. If the intensity of the SI pain is only increasing, back off a little, maybe try wiggling the hips a bit. If you're noticing you're able to relax the low belly, relax the low back, and things are starting to soften in tension, stick with it. Right, through the belly space, there's so many different organ systems, so many different nets of nerves, so many different muscles. They're moving through this space. Go slow with yourself and recognize there's a lot that could be happening here. Your job as the observer of the mind is to notice changes in sensation, witnessing a release of tension that we've been holding through our belly and low back space. Find nice, full, deep cycles of breath. Alright, very slowly start to press yourself up out of this position. Take the pillow out from underneath you. Before you switch sides, and your legs down and lift your hips up. Bring your floating arm up over your head, stretching the side body. Do this a few more times, flossing out the low back and side waist. Good. Next time you lift your hips up and extend your arm long, windshield your upper arm down to meet the stable arm. Roll yourself forward, you're in a tabletop position. Move through flexion and extension of your spine or cat-cow pose. Inhale, drop the belly down, lift the chin, flare the tailbone. Exhale, chin goes to chest, round your ribs back, and pull belly button to spine. And then tuck your toes under and stack the hips on top of your heels. Keep your hands down on the ground and floss your knees up and down, slowly opening the arches of our feet. Right, there's a deep connection between the arches of our feet and our sacrum tension. So if our sacrum, which is that one bone, it's the S part of the SI joint, is tight, this could be causing some of the pain you're feeling through this joint space. Good, and then we're just going to switch sides with the pillow, wrapping in force underneath the opposite side waist, that soft part between ribs and hips. Laying down on the pillow. Big inhale. Big exhale. Once you got your wiggles out and you're finding a comfortable position, settle into the felt sense in the body. Work on softening and feeling heavier where you can. Where can we find softening in our body through cognitive control? How can we facilitate releasing of tension through expanding our breath cycles, increasing our belly breathing, trusting the felt senses that we are feeling, knowing that yes, we may feel tension now, But over time and sticking with the practice and sticking with this posture, that sensation of building tension will and can change and soften. We're cultivating the idea of healthy stress in the body. This is not an easy ask, specifically if you deal with chronic pain. We deal with chronic pain. Our nervous system has a changing of wiring on how we perceive sensations in our body. Our alarm signaling in the brain is hypervigilant. So when we know that we're hypervigilant to sensations, in a safe environment like this class right here, we are teaching our body what it feels like to work with some sensations that we're hypervigilant to, and choosing to stay with sensation and learning what it feels like to have that sensation of tension build and then soften. Remember that ability of physiological resilience to feel sensation build and then lower and change is not accessible all the time for people. So if the alarm signals in your brain are so loud and they keep on building and building and building, please move and get out of this posture if it is too much for your body right now. Learning how to find your edge when you deal with chronic pain is extremely hard to do. It is an ever-changing landscape. Learning how to have grace with yourself when this happens and finding movement that is safe and joyful for you is the real work. Because we know movement and exercise is extremely beneficial for many different systems of our body. And so we sit here in silence with ourselves, with our sensations that are probably pretty uncomfortable, and hope that over time sensations relax and change. Big breath in, guys, and out. All right, same thing on this side. Slowly lift yourself up, take the pillow out from underneath you, root down through your stable arm, lift your hips up and down. And next time you lift your hips up, extend your arm long, open up the side body, breathe into your rib space. And the next time you lift yourself up, arm goes long, it windmills down to meet the stable arm. You're in tabletop position. Few rounds of flexion and extension in our spine. Cat-cow, find a nice big breath. Alright, and then take the pillow, put it underneath your knees, and step your right foot forward. Bend at your right knee, and come to a low lunge. Bring your hands to your hips and very intentionally engage your low belly so you find neutrality through your hip bowl. And then we pulse our hips forward. We're trying to isolate the stretch, moving through our upper thigh and not our low back. Right? So we're learning how to floss open the anterior part of our hip. Move as slow or as fast as you need. This can be a hard and interesting space to learn how to find the details and subtle cues in. Good. And after we floss, we're actually going to sit in this posture and hold it for about 30 seconds. So find a comfortable place where you can lean your hips forward and find stretch through your quad and your front of your hip. And then you hold here and breathe. Good. Keeping our core engaged. Bring your left arm forward and your right arm back. Gentle twist specifically through the mid part of our back. Both of our hip bones are facing forward and are stable and level with that low belly engaged. Big breath in. Exhale. Windmill the arms down to frame the front foot. Tuck the toes under. Lift the back knee off the pillow. Press through the back heel. And then with strength, encouraging the belly button to come to the spine. Step the right foot back to meet the left. And do some gentle plank to downward dog pulsing. And this movement is happening through the initiation of belly button wrapping into the spine. Strengthening our low belly and our deep, deep abdominals. Good, and when you're done, you're done. Bring both knees down onto the mat. This time set the left foot forward. Stack your torso on top of your hips. Bring your hands to your hips, low lunge, and find some neutrality through the pelvic bowl. So either we're tilting our hips forward or back. Engagement of the low belly, lifting of the pelvic floor, crown of head is moving away from the sacrum. And then we start that flossing, encouraging the hips to move forward. We find a nice opening happening through the front of our hips and quad. Activation is happening through the left foot as we root down. We're finding lift through our spine. Gentle flossing forward and back. Slowly start opening our hip flexors. Finding a longer resting length of those low back muscles that connect our spine with our hip and femur bone. And when they are chronically too short, that can also put pressure on the SI joint, causing the aspect of that joint space to change either anterior or posteriorly, which can be a source of pain for this region. Good, and then once you've flossed, we're going to find a space where our hips are leaning forward. We're stretching out our quad and our hip flexors, and our low back feels strong and stable and straight. And then we land here and just slowly try to breathe through the sensation, giving the hip flexors some time to open up and lengthen. Then reach your right arm forward, left arm back, twisting your spine towards the front leg. Big inhale. Big exhale. Windmill the arms down, tuck the back toes under. Pulse through the back heel a few times. Left foot back to meet the right, both knees down. And then wiggle yourself forward so it's your booty sitting on the pillow. And the front of your shins and ankles are on the ground. Bring your hands behind you. You choose. Fingers can face away from the pelvis or towards the pelvis. Then we find engagement through our core to keep our hips nice and neutral and protecting our low back. And then we lift our hips up. Opening this deep, deep foundational layer of our belly. Do this a few times and then let it go. This can be a lot on the ankles and shin regions, so be gentle with yourself with this. Good, and let it all go. And then bring your feet out in front of you. Toes facing forward. Fingers facing the same way as the toes. Reverse tabletop position. So lift your hips up with engagement through your belly. The movement is happening through the hip flexor, so the hips are lifting. You're pressing down through your heels and opening up the front part of our chest. Do this a few more times. Shake out the legs, let it all go. Big inhale, big exhale. And then tuck your left foot under, bending your knee, and the right foot wraps around. Gentle twist in the legs. Hug the right leg into your chest, then twist your torso to the right. Looking towards your back body. Nice big breath in and out, slowing down the heart rate, catching our breath. Opening up the side part of our hips, lengthening our external rotators. And then move your legs into fire logs. So your left shin is going to come parallel to the front of your mat. Your right ankle hooks on the outside of the left knee. Then you're encouraging your right and left knee to both move closer to the ground based off of your hip anatomy. You maybe need to shuffle your booty a bit back so you're landing on your sits bones. And then you breathe deeply, allowing time to open the density of your hips. Good, shake out your legs. Switch sides. This time right leg wraps behind you. Left leg wraps over the right. And you're twisting your body up and around your center line towards the left side of your body. Head is turning around to look behind you. Again, you're using the tension of pulling your top leg in to help you find length through your spine. This will encourage your sits bones to move closer to the ground so you can find more lift out of your spine, isolating the stretch to be moving through your hip space and less into the low back. Good, and then move yourself into fire log. So both shins are parallel with the front of your mat, and you're encouraging your knees to come closer to the ground. Nice big breath in and out. Shake out the legs, let it go. Then we're going to finish off class by standing. So come to standing. Find equal weight in the feet, bend the knees a bit. Bring your hands to your hips and try to find a neutral pelvis. So think belly button more to spine, low back should feel lengthened as crown of head is moving away from the hips. And we close our eyes and bring our hands to our low belly. Trying to map out our felt sense in this position. How can we find equal stance between each one of our feet, and what does it feel like to have a neutral pelvis while standing? If you have SI pain for postural reasons, which is the majority of people, we are hoping to create this felt sense in our body more often throughout the day. This will put less strain on the SI joint. Our sacrum and SI joint have a lot of fascial connections to our pelvic organs. So when we can have our hip bolt and be in a neutral position, we are actually holding our pelvic organs. So when we work on finding neutrality and finding even weight between each one of our feet, it's a really helpful way for us to posturally change some habit patterns that will help us not feel SI pain or discomfort day in and day out. I'm going to end this class here. I hope it landed, and I'll see you next time.